Oops.
More than ready.
Tyler?
So what I'm gonna do is I'm gonna share my screen here so I can get the PowerPoint up once. Oh, looks like I cannot share my screen.
Yep,
there we go.
Let me.
It's good now, it looks like.
Okay.
All right, perfect. So sorry for the busy computer here, but all right. So for everyone who has never met me, which I think is, I can't recall if I've met anyone here, but I'm Tyler Harrington. I'm a doctor of physical therapy over at Capital PT here in Verona, just down the way from the senior set a little bit. I'm going to be talking to you guys today about healthy aging. So how do we age healthy? Now, the first thing we kind of got to figure out is what is healthy aging? Now, I took this from the World Health Organization, but they describe healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. And so that's a big, very kind of vague statement, but I take it as more of we really got to make sure that as we get older, we're still able to do anything and everything we would want to do. Whether that's something like going to visit friends, going to church, going out to dinner when COVID's not going on, but also being able to do things you need to around the house, doing laundry, doing dishes, being able to do it without having too much limitations from either fatigue or anything like that. Now, to kind of address healthy aging, one of the things we also got to talk about, what is normal with aging? So a lot of people, as we get older, these changes happen to our body, to our mind, to our strength, that people are a little concerned with that may or may not be normal. And the important thing is to kind of figure out what is normal. I like this picture here because it's a really common description or picture of what happens when we age. So we start off on the left and we're very tall, no gray hair. As we get older, we start to have that little bit more forward flex posture. And I'll go into kind of why that happens, but it's all very normal. Now, these are a couple of things I thought were important for everyone to know with regards to normal aging. Now, what happens with strength when we get older? So as some of us may know, we do tend to get a little bit weaker as we age. Now, from a study by Gervin et al. In 2017, they found that we actually tend to peak with our strength at about age 30, which was very surprising to me even, and I thought it would be a lot later on in life. But what ends up happening is at age 30, that's usually that peak, and then thereafter, depending on individual, it starts to decrease over time at a steady rate. Now, that is not a given, and what I mean by that is we know that is generally the common consensus there. But if you work at it and you're able to minimize that steady rate of decrease, you can actually stay stronger a little bit longer. And that's what we do with a lot of the strengthening exercises. We're not intending to get you super, super strong. We're intending to minimize any decline. Now, also what happens is endurance can decrease. So things that you found were really easy to do early on in life, like mowing the lawn, may become a little bit more fatiguing. You may have to take breaks. You may have to break up the lawn into quadrants or segments to make it more tolerable. Now, range of motion. So as we get older, we tend to get a little bit stiffer. And that has to do with our joints getting a little bit stiffer in some senses, and then our muscles losing their flexibility. Now, all of those we can definitely improve on as we age. It's the exact opposite of the strength kind of argument we made. You can actually improve your range of motion up until older age pretty consistently. Now, let's go to cardiovascular. I think this is important, especially for healthy aging. So as we get older, our blood vessels and arteries get harder. They get stiffer. So if you can imagine a garden hose that get really rock hard, if you have to pump water through that garden hose, it's going to take a lot more pressure from whatever pump you're using to pump it through. And that's what leads to increased workload on the heart sometimes with that. So what we got to do is really, really work on our diet and work on our exercise to minimize any stiffening of those blood vessels further than they already will. Now, one other important thing I forgot to mention is decreased lung expansion. The big thing that has to do with that is if we go back over to our muscle flexibility, when we breathe in and breathe out, our rib cage has to come in and out with us. And as we age, those muscles that interconnect our ribs tend to get a little bit stiffer. So the expansion isn't as great. We can't breathe as efficiently. All right, now memory and cognition, we do tend to have a decrease in our ability to memorize short-term memory things. So not necessarily life events like when our daughter or son was born, more so what did I have for breakfast yesterday? Other things that can happen is we also lose the ability to judge distances. So there's visuospatial changes, which can be very, very impactful on things like balance. And so all of this is very important to know that it's normal for this to happen, but does it mean that we can't address it? We can definitely address it. Bones and joints. So what happens as we age with bones and joints? So generally speaking, bones decrease in size and strength as we get older. It's more common in females and typically has to do with the postmenopausal age and hormonal changes that occur with it. But men also will have a general decrease in size and integrity in the bone as well. Now, if that does happen, that leads to greater risks of osteoporosis, osteoarthritis, things that are kind of associated with more pain, not so comfortable symptoms. And that's something we just gotta wanna look at and address to make sure we're living healthy as well. Now, joints become stiffer, and a lot of that has to do with the cartilage beginning to wear. So cartilage provides the lubrication to our joints, so they glide and move pretty smoothly. As we get older, we tend to lose a little bit of our cartilage, and that creates more of that that clicky, the clacking sounds with some movements in the joints. And that's not necessarily a bad thing, but that's just a normal process of aging. Now, this picture here, let me move this just a little bit out of the way here, is a new kind of variation of the first picture I showed you, is just what happens with our posture as we get older. So if you look at this picture right here, we're standing up really tall. Our hip is right under, or right over the top of our pelvis here. And then if we go over here, what happens? So we start to get a little bit more hip flexion here. So a little bit more bend in our hip compared to this one. And we actually get more of a sway into our low back. Now, the reason that is because we lose our disc height in our joints and our back as we get older. They're actually very water-based, and as we get older, we lose that water. So we tend to get a little shorter as we get older, and that is normal. I've had patients come in, I'd probably say every couple of days, who have said, I think I'm getting shorter. And in actuality, it's a very normal thing to get shorter as we age. We all do it. There's no one who is going to be abstaining from getting shorter throughout their life. It's just a natural process. Now, one thing that's important, though, is this is still a normal process, but we want to try and minimize this positioning as best we can. So part of healthy aging is working on posture and how to kind of minimize the advancement of any of this aging posture. We also have changes in our ability to sense things. So our 5 main senses, vision, hearing, tasting, feeling, all that good stuff. We want to make sure that we're addressing any changes there are. So some common ones that we do see as we age are decreased ability to sense light touch. This picture here is an individual pressing a little firmly on the foot here to try and sense if this individual can feel from the bottom of their feet, which is also very important for balance. Now, the second one here is decreased proprioception. Now, that is a big, large word. Do not try to remember it. But more or less what it means is our ability to sense a position of our body without us actually looking at it. The way I kind of describe it is, if I close my eyes and I bend my wrist back, how do I know that I did that with my wrist? I'm not looking at it. It's that feel. You can feel that the wrist moved backwards. So as we get older, that kind of feeling gets a little bit less. And that's something that's also very important with regards to balance. Because if we lose that ability, we want to make sure that we're kind of minimizing that loss to optimize balance later on in life. Visual changes, hearing loss. One important thing that I always think is a very good safety tip is, as we get older, we do lose the ability to sense our temperature changes. And I'm not talking about like outside in the winter, that you guys will readily be able to tell it's winter outside. But more so when we get older and we start using hot packs or cold packs for a little bit longer, what can happen is if we leave them on a little bit too long, we may not notice that it's actually causing a little bit more skin irritation than good relief of any aches or pains or stiffness that you may have. So that's just something to be conscientious of. Now, this here is a nice kind of little diagram of how I view optimizing aging. So the important part to know is healthy aging isn't just diet and exercise, it isn't just making sure that you are going to your doctors all the time. It's not just interacting with friends on a daily basis, getting out and being social. It's a cumulative sum of all of it. We want to make sure that every aspect of your life is healthy and that as you age, every aspect remains healthy. Now, this is a very common model I use with my patients to kind of just really give them the nuts and bolts of what's important for our entire health with regards to going forward as we age. So, and I'll talk to these more in depth in just a second, but the first and foremost one is facilitating social engagement. We always want to remain as social as we can. There's so many health benefits with remaining social. Now, another aspect of healthy aging is promoting your overall health. That can be preventing any injuries, managing any chronic conditions you may have, minimizing any results from those chronic injuries, and so on. Other parts are optimizing physical, cognitive, and mental health. So reducing any stress, making sure our aerobic system can tolerate any activities like long errand days, going to the grocery store, anything like a nice walk in the park. We can all do that without having to worry about it stressing our system too much. Now, this is a very busy slide, and I apologize for that, but I thought this was a good kind of synopsis of how social engagement can really make an impact on your health. So there's many studies that have shown that it actually improves our cognitive function. And so when looking into those studies earlier, it has to do with the ability to interact with language, deducing information, transferring information from person to person. That really helps maintain cognitive function as we get older. Now, there is many studies that actually show that it actually can increase our lifespan, being social. So they did a study where they looked at somebody who was deemed as a socialite versus a non-socialite. And off the top of my head, I can't recall exactly what differentiated the two, but more or less the ones who were deemed a socialite actually had less mortality ratings. So they died a lot later in life versus somebody who was not as social. Now, ideas that I think any aspect of being social will work. There's no good way, bad way to be social. Obviously, stay nice, be nice to people, but also as long as you are staying social, that's the most important thing. Here's a couple ideas where some people are like, that's being social. I didn't really think about that. But volunteering, going to any church services. Oh, we got a chat. Let's see. Well, perfect. That's a good option. Yeah, visit the senior center. Perfect. That's a good option. That is a good one. Thank you. And then staying connected with family, friends. Obviously, with everything going on, COVID related, I think the good things to do are writing letters because it shows that real kind of personal touch, and it actually makes you work on your fine hand movements, which as a physical therapist, I think is always an added bonus. Now, making phone calls. If you are familiar with Zoom, you can always Zoom night with your family. You can have a Zoom game night. One thing I looked at too was Parks and Recs, and this isn't necessarily specific to Verona itself, but this was a good idea of things you could associate or who you could contact other than the senior center, obviously, if you did have ideas for being social. But exercise classes are huge. Every Parks and Rec, 9 in 10 park and rec agencies will offer exercise classes, volunteer opportunities, field trips, events and festivals. A little bit less common nowadays, but still, if you need any ideas, I can get some events or festivals that are virtual, which will help with any social gatherings. Arts and crafts, I think that's so big with regards to social engagement, but not only social engagement, but cognitive health throughout later life. It allows you to be more abstract, kind of refire your neural or your brain's inner workings to allow for it to be most efficient and really optimize your cognition later on in life. All right, so One important aspect, if you remember that guide I like to use, is managing your chronic conditions. Oh, so it looks like there's a bead workshop and a yoga. That'll be yoga. I always talk about later in my my lecture is a very, very good physical exercise to do as we get older. Range of motion, strength, and also balance. Very good aspect. So I highly suggest getting to that one. Chronic conditions. So big things that are common. So I just found this chart with the 10 most common chronic conditions for anyone older than 65. And all of them seem very common. So hypertension, high cholesterol, arthritis, heart disease, diabetes, all of them are very common. Now, because they're common, they're something we can't really ignore when we're talking about aging healthy. So we have to kind of do our best to not only acknowledge them, but address them as we get older. And a good way to kind of do that is, first and foremost, daily exercise and physical activity. And I'll go into kind of recommendations, more specific recommendations in a bit. But I think if you're doing just any daily exercise or physical activity, that'll help reduce the risk of those chronic conditions getting worse. But also it can actually, in case of some of them, completely resolve some of the symptoms associated. One thing that people forget about that is really important in managing chronic conditions is getting good sleep at night. So depending on who you talk to, usually people and experts will want you sleeping for at least 7 to 8 hours a night. Now, a lot of people, for a variety of reasons, aren't able to do so, whether it's difficulty getting comfortable because of any aches and pains, just not feeling tired, our mind's racing, we have a lot of stressful things in our mind, stuff like that. But trying to find certain techniques to allow for at least 7 hours of sleep a night will help with that. Some common ones that I give out is try to minimize napping throughout the day. It's one of those ones where if you nap throughout the day, it takes away from that natural fatigue that gets us tired to go to bed at night. Also, if you're having trouble sleeping and you're laying in bed, don't toss and turn. Don't sit there and lay there. A good thing to do is to get out of that bed and return when you actually feel that fatigue and your tiredness. Because if you just lay there and lay there, it's not going to make it progress to that point where you get tired. You got to go up and actually not do anything too strenuous, but getting out of that bed creates that physical activity and that mental activity that can tire you out a little bit faster. Regular checkups with primary cares. I think this needs to be said over and over again. I think the most important thing is knowing where we're at with our conditions. If we don't have any idea where our blood pressure is, where our cholesterol levels are, where our HbA1c for diabetes is, how are we going to know if we're managing well or not? I think it's really important to stay on top of it. It can be pretty cumbersome and daunting to have those regular checkups, but I think it's really important in the grand scheme to really manage our health later on in life. Other important things, eating healthy, making sure we're managing our stress, and most importantly, which is usually a tough one, lifestyle modifications. One big one that I have on here is smoking, but it can be anything from, if we generally do a lot of sedentary activities, so if we're sitters throughout the day, whether that's your job or you just enjoy sitting and watching the local news, a TV show, etc. The big thing is trying to modify our sedentary behaviors. Usually there's a kind of a new saying that goes around that sitting is the new smoking. A lot of research is stating that it's very, very impactful and in a negative way on our health. So one of the big ones that I always say is managing these chronic conditions. One of the easiest things you can do is just not sit as much. And that's not, don't take it as stand all day. That is not what I'm saying. But if you're doing something you enjoy, let's say you like watching the morning news for 30 minutes in the morning, maybe at that 15-minute mark, just stand up for a second, kind of stretch it out, and then go back to sitting, just to break up that static sitting throughout the day. Diet. This is an important thing with regards to overall health. One of the big things that they're finding is the important, or that is very valuable for any aging healthy diet, is this Mediterranean diet. Now, this is very, very popular nowadays because it is shown to overall increase longevity in life and overall decrease mortality. So people are living longer having eaten this diet. Now, what it basically is kind of what I wrote out here. So it's a higher fiber diet, so high fiber cereals, low fat dairy. So trying to get as low fat as we can if we're having any dairy. And then the two big ones here, or I should say the multiple big ones. So fruit and vegetables are the two big ones. If you see this pyramid over here, they're the largest box. So those are what we want to have the most of, our fruits and vegetables. Now, if you go up the chain here, we have, looks like red meats. And that is something we want to actually reduce in how much we eat. In the United States, we tend to eat mostly, I shouldn't say mostly, we eat majority red meats. We need to start tapering towards more of the fish and seafood or the lean meats like poultry. Other important things, vitamins and minerals. So one big thing that I forgot to mention with regards to bone health is as we get older, our calcium storage as well as our vitamin D intake tends to reduce a little bit. And that can have further consequences on our bone health. Now, these are just the daily required allowances for either of these to help with bone health. So calcium is the main object in our blood that allows for bones to form. The calcium comes together and builds bone up. And so when we do that, we also need vitamin D. And the reason why is vitamin D is what actually allows the calcium to be absorbed to start building new bone. So without vitamin D, the calcium's just not going to be able to form the bone as well. So vitamin D can be absorbed through, this is tuna and eggs. There's a bunch of other foods that you can naturally get vitamin D through. And then calcium, common ones, anything dairy related, milk's a big one, broccoli, kale, and salmon is also a big calcium food. So I think incorporating foods that have higher calcium, vitamin D will help with your overall health as we age. Okay, so cognitive health. So we're getting into more of the exercise part of it. Now, cognitive health, a lot of people just kind of associate that as we get older, we're going to lose a little bit of our memory. We're not going to have the necessarily cognitive speed that we did when we were younger, which isn't necessarily the truth. I think it's definitely a thing as we get older where that is possible, but there are things we can do to try and minimize that from occurring. The first one is regular physical activity. So there's been studies out there that show that the physical activity actually increases blood flow to the brain, which makes sense. You're working harder, your heart's pumping faster, more blood will get to the brain. Now, the importance of that is kind of what I wrote after that. It's more oxygen to the brain. So if the brain has more oxygen, it's more able to fire. It's more able to concentrate on the things you need it to do, whether that's balance, whether that's reading a book, anything like that. So more physical activity allows the brain to have just more of an aware presence, if that makes sense. Another thing here too is it actually has been shown to increase our neurotrophic factor proteins in our brain. You don't need to know what those proteins are, but the important thing that they do is they actually promote health. So any sort of neuron damage, inefficiency, they help re-promote its health, and they actually are able to form new neuronal pathways, which is huge in things and disorders like Alzheimer's or dementia. It's really, really important. Now, other aspects of cognitive health and managing it are just staying mentally active. As I said, as we get older, we do have that general decline in our cognitive processing. So things that help with that processing is reading books, playing word games. And one thing that people don't do enough, and that's across all ages, is learning something new. So when we learn something new, what we're doing is we're challenging the brain in a different way. So those proteins have to form new pathways to allow for us to learn that task. So doing something or learning something new is really, really important for managing our cognitive health later in life. Now, the physical activity portion. So this is kind of my bread and butter as a physical therapist. So I took some recommendations just from the World Health Organization on physical activity to help with healthy aging. So the World Health Organization recommends about 150 minutes of moderate intensity aerobic physical activity throughout the week. Now, that may seem like a lot, but if we break that down into 7 days, it's not too bad. It's actually about 20 to 30 minutes a day, nothing too crazy. Now, how do we gauge if it's moderate intensity? So the big thing that I thought was really helpful when I was trying to describe it to my patients is this saying here: you should be able to talk while you're doing it, but if somebody asks you to sing your favorite song while doing it, you wouldn't be able to because you would lose your breath. Now, what can be moderate exercise? So that can be anything, which isn't very helpful in this sense, but it can be anything from doing your laundry. If you're feeling like it's getting you a little bit, what I call is warmer inside, your body's starting to get warm, that's what I would also consider moderate exercise. Anything from mowing the lawn, doing dishes. I know a lot of my patients walk their hallways, and doing that long enough will get them to the point where they feel that warmth. They feel like, yeah, I probably can't sing my favorite song. This is pretty good intensity. Not too much, but not too little. Now, one important aspect the WHO also kind of recommends is performing in at least 10-minute bouts. And the reason that is just to help build endurance. So our aerobic system is always working, whether we're sleeping or actually awake. And so when we're awake and we're stressing it and we want to challenge it, we have to work endurance-wise. So trying to work for longer periods of time as we tolerate it. All right, so what are the benefits of exercise? So these are just some very common ones that I have a little pamphlet here that I talk about. But reducing heart risk, heart disease risk, we're improving lung health, improving your weight, improving bone health, and it can prevent constipation. It improves the blood flow to the body and brain, and it reduces stress, and it can actually have a positive impact on any depression. Now, this is kind of what exercises should I do as I get older? Now, all of these play a pivotal role. So as you guys remember from that original picture on posture as we age, postural exercises are very important to make sure that we're minimizing that forward stoop position, to minimize any of that increased sway in the back, to really make sure that we're not allowing our body to let gravity push us into those positions. Strengthening exercises. So those are just generally amazing for muscle strength, obviously, but also for bone health. So anytime you are strengthening a muscle, that muscle originates on a bony area of the body. Anytime that muscle pulls on the bony area of the body, the bone actually is allowing for more reformation. It's getting stronger. So strengthening exercises are huge as we get older to prevent anything like osteopenia or osteoporosis. Range of motion exercises. As I said, we get stiffer as we age, so we got to make sure that we're keeping everything as mobile as possible. And we just talked about the light to moderate aerobic, and then balance exercises. So here are some postural exercises I kind of put together in a slide here. These are some common ones that I find are a little bit more typical in the older adult, but a lot of that forward posture. So I'm going to turn to the side here. And so when we see an older adult, we kind of get into this slouch position. So we go from nice and tall to here. And what ends up happening is we want to minimize those type of positions. How do we get into poor posture is the important thing that guides how often we should do it. So I always tell my patients posture is developed throughout a lifetime. So I don't expect anyone doing any of these exercises to get better after doing it once or twice. This is one of those exercises that we do as consistent as every day, and 2 to 3 times per day minimum. That means if you were doing something like watching your TV or reading a newspaper early in the morning, that's something where we can practice these type of things while doing it. So let's take this exercise here, which is called a chin tuck exercise. This individual on the left is kind of mirroring that positioning of the head that I was saying is not as positive. What we do here is we're trying to reverse this and bring it the opposite direction. And what we're doing is trying to minimize any strain on this mid back here and upper neck. or lower neck, I should say. And then these other exercises are also meant to do the same. This is a common one I give for any low back, lots of sway type individual. Have any of you guys seen this exercise before? This one right here? Yeah, okay. This is a common one. And one of the things I always tell with this is some people will comment, it doesn't feel as comfortable in my back. It bothers my back a little bit more. Now, if that's the case, what I usually tell people is you don't have to go up as high as this individual is here. You're still successful and you're still getting stronger and improving your posture if you only get a little bit off the table. It's the act of trying to kind of get end goal here, trying to get towards it, but I don't expect anyone who's just starting to do these exercises to get full, straight first thing. We start small and increase, and that's the same thing with all of these exercises here. I'm not expecting you guys to have a perfect chin tuck right away. You may, you definitely may, but I wouldn't expect it. And if you try it and you're like, oh, it's a little stiff, you may have a little bit more stiffness, but it should get better with more consistent performance. Strengthening exercises. Now, there's two types of strengthening exercises that I think are very important for different reasons in the aging adult. So first ones, and that is going to be all of these pictured anti-gravity exercises. So as we all know, gravity is pushing down on us all here at Earth, keeping us firmly planted on the ground. Now, what helps us build our bone strength and our muscle strength is actually doing exercises in the opposite direction of gravity. So you see this individual doing a sit to stand here. He's working on just no added weight resistance, but working against gravity. That will also help practice for getting you more functional. So that brings me to the second point. These exercises should be functional. And what that means is anything that you have trouble doing. So let's go back to this guy here. What if he had trouble standing up from a chair or a lower sitting chair? What I would do is have him work on that exact thing. Now, I would probably raise the seat height up for this individual to allow for better success. But I think that's something that gets kind of missed somewhere along the lines where it should be functional. It doesn't have to be like going to the gym, squatting 300 pounds, bench pressing 300 pounds. It does not have to be that. And even so, let's say, Tyler, this is too difficult for me. What can I do that would be similar and as beneficial? You can go right here to this picture next to it. This is an assisted squat. So the picture is not doing it as good as I like, but I usually would have my patients grab onto their kitchen sink because they can use their hands to hold on a little bit better. And that's where you start to mimic this sit down as far as you're comfortable doing it, using your hands to help, and then you stand up tall just like this individual did. You're still doing work against gravity. You're still getting stronger. It's just a little less intense and allows for more success if this is too difficult. Oh, there we go. Now, other important things are going to be upper extremity strengthening. So a lot of difficulty as we get older is with reaching overhead or reaching to the top cabinet to get something out, reaching far out in front. The strength isn't always there. You can do exercises against gravity to help strengthen those type of movements. Now, with regards to anything that's strengthening, I tell people that it should not be painful while you do it. It should be muscle activating, so you may feel a strain on your muscle that is normal. It shouldn't be painful. Now, you may have some soreness afterwards that is also normal, but when I say soreness, I'm thinking very light soreness where you feel it, but it's not stopping you from doing anything. It's something where you're like, oh, I definitely worked hard today, but I can still do whatever I want. I can go walk a mile. I can go up and down stairs. I'm feeling good. That's normal soreness. All right, range of motion exercises. So these ones cannot be missed, especially if you are what I call in the population of a go-getter personality. You are always on the go, you're always doing things, volunteering errands, helping out people around you, those kind of people. These ones are very important because if you are working so hard throughout your day, just doing what you normally would do, we got to make sure that we're allowing these joints and these muscles to get this passive kind of relaxed movement in them. So two types I do a lot of are going to be static stretches and dynamic active or passive range of motion exercises. So just like the strengthening ones, these should be pain-free while you're doing them. Now you may feel a pull or a strain, maybe, but it shouldn't be something that's contributing to any long-term soreness afterwards. So this is not one of the ones where if you get done doing them, you're like, oh man, my back's really flared up or my knee's a little bit more sore. Then we would have to look at how you're doing them, but these should be relatively pain-free. Now, static stretches. So this is really good to help promote muscle flexibility as we get older. It is really helpful too with muscle relaxation. So if you are one of those individuals who loves doing a little bit more sitting throughout the day, these two pictures are very, very good for stretching common muscles that get tight when we're doing a lot of sitting. So this picture here is a stretch for our front part of our hip. Now, this exercise can be a little difficult doing on your own just because of this, but the big idea is keeping everything nice and loose in the hip flexors. And then on this picture, the hamstrings. So getting the backside of that leg nice and loose. Any stretch you do, I always tell people, should be able to be held for 30 seconds. It shouldn't feel like you're resisting yourself or you're shaking, you're kind of struggling to hold that position. It should be very comfortably uncomfortable is what I kind of describe a stretch as. Now these ones, I use the saying, motion is lotion with regards to these type of exercises. You want to keep moving in your pain-free arc of motion and not pausing. So like this exercise, she's doing a knee fall out to the side. I call them windshield wipers. So what we want to do is slowly move our hips out to one side and then the other to allow for our hips to loosen up so our back and our hips don't have as much stiffness or strain in them. All right, back to aerobic exercise. So this is just a slide of kind of what I talked about earlier, different options for aerobic exercise. Again, we want to just make sure that we're doing it in about 10-minute bouts. So that can be anything from brisk walking or hiking. I know my wife and I, before COVID, did a lot of the dance classes, and that was really awesome aerobic exercise. Gardening. Gardening is a huge one. Most people don't see that gardening is that hard or that much of an aerobic exercise, but it really is. It's one of those ones you're changing position, you're bending forward, you're walking on uneven ground, you're pulling out weeds. It's actually a really good aerobic exercise. Swimming is one that if you have access to a pool and you have any sort of aches or pain that limit any aerobic exercise, it's a really good one to offload any joints or really reduce the strain on the muscles. Cycling's a common one for the same reasons. And then just the stuff that we don't think about, performing household chores. So mowing the lawn, doing laundry, if we have to vacuum, all of those are very good aerobic exercises that a lot of people don't see as exercise, but I call it the normal functional exercise that we do in our day. All right, now balanced exercises. Now this is probably one of the most common things that I will teach my patients as they get older. For majority of low back, any lower extremity issue, balance exercises are always going to be a pivotal point. And the reason it is balance is so impacted by everything that I talked about that changes normally with aging. So it's impacted by our vision changes. It's impacted by our ability to sense things in the bottom of our feet. It's impacted by our strength, our range of motion, all of the above. So balance exercises are always very, very pivotal to continue doing as we get older. Now, a lot of people have done either balance classes or seen some sort of balance exercise. And I always tell people that the most important thing is it should be challenging, but it should be safe. So let's take this picture here, this top one. So this is a good exercise to really work on single leg standing stability. So if you were to have a position or a movement when you're at home that you're only on one leg, do you have the stability to stay upright, or is your balance going to be a little bit off? May you fall or something like that? Hopefully not. This is an exercise that I always say, start with both hands on a supportive structure like this chair. Ideally, it's a harder, heavier chair that's not going to move and it's not on wheels, or a kitchen counter. And then as you're able to do something like this more comfortably and do it very slow and very controlled, you can reduce how much handhold you have on that chair. You take one hand off, or you can just reduce the pressure from both hands a little bit. Maybe do 2 fingertips. That's a good way to challenge it, but keep it safe. Now, some people, when they're doing balance exercises, can be very fearful of falling, which is very normal. And I always tell people, acknowledge that fear and then proceed with safety as number one. Only challenge yourself if you feel like you are, I guess what's the best way to put it, at that point where you are confident in your ability to do it with or without support. But always think, be safe first. If you're doing any of these exercises and your legs are really shaking, that's something where we may add more support. So put more hand on there, get more, or do it a little slower. Don't bring your leg out as far, things like that. Now, balance exercises, I always tell people it's very similar to the postural exercises. You can't do them enough. I always tell people it's always easiest if you kind of just build them in throughout the day. Like I'll have a patient who will do something like stand on one leg while she's got one hand on the counter and while she's brushing her teeth in the morning. Stuff like that, where you can just build it into an easier part of the day and you don't have to worry about feeling like you're doing a ton of balancing throughout the day. That is actually all I have with regards to the healthy aging or aspects where I think we can really make a difference. Does anyone have any questions?
I have some questions.
Of course.
Can you talk a little bit, Tyler, about like proactive versus reactive therapy? So somebody doesn't need to necessarily wait until they have a fall to get your services, right?
Correct. I think I'm a big analogy guy over at Capital PT, so I use a lot of analogies. One of the big ones I always tell people with proactive versus reactive is we got to think of ourselves like a fine automobile. If we were originally built in the 30s, the 40s, the 50s, and we want to keep that car running into the 2020s, usually and most often what we have to do is do routine kind of maintenance. We have to make sure that we're starting the engine every month, so often, couple of months, just to make sure that everything with the transmission, the engine, the oil going through all of it is going smoothly. And that'll allow us to kind of keep going a little bit easier on. Now, with regards to any injuries or chronic conditions, and especially balance too, one of the big things is being proactive. We do know that as we get older, our vision will decrease, our ability to get stronger decreases, our range of motion gets a little bit less, and all of those will have a negative impact on overall balance. And so knowing that, we got to kind of more or less cut it off in its tracks a little bit. We got to go in there and see. It doesn't have to be with a physical therapist, it can be, but realizing that there are things that we can do to optimize it before it ever becomes an issue. One of the big things that's really important is ankle strength and hip strength, because when we get off balance, we have to have the prerequisite strength to kind of get back onto balance with hopefully or with avoiding a fall, I should say. And so if we know that our hip strength, like if we were, I guess I always tell people, is like, how do you feel going up or down stairs? Or how do you feel going over and down a curb? Because those are very differing things. A curb has usually no handrail, stairs typically do, and there's 1 versus 15, or a flight, I should say. And that's one of those ones where, hey, maybe I'm not going up the stairs one over the other. And you're like, I feel pretty good about my balance overall. But that's something where usually when I see people can't go reciprocal up the stairs, something like that, that's where I would say, maybe the endurance in their hips or the strength in their hips isn't what it used to be. And that can overall be impacting their balance to allow for one leg to transition to that next step, to that next step. But I think it's very important just to know that the aging process is very normal, but we got to address a lot of things before it becomes an issue later on in life. And that's that proactive versus reactive. Because I do see a lot of people who they lost their balance and they do have an injury to their knee, and they're coming to see me. And that's not necessarily a bad thing. I still think you're going to be doing great if you do that way as well. But I think it saves you a lot of time, money, energy, fatigue, stress, long haul, if you kind of address it first and foremost before it ever becomes a negative thing with regards to health. And that's the same thing with anything like the chronic conditions too, is a lot of those things. Like when I hear the word arthritis, I'm like, oh, I don't want arthritis. That's not good. And in actuality, arthritis is just a term. I see a lot of people with really, really severe arthritis on x-rays or any imaging, and they're moving around better than my 15-year-old nephew. It's just a matter of being able to kind of know the things, and you may not know the answers, but know that you can seek out the answers and know the things that'll help with it. So for example, arthritis, a lot of what helps with it is movement. And usually people, when they move things, they're like, oh, I did a squat and my knee arthritis bothered it, and it just really tightened up on me. And that's very normal with arthritis. But usually what I would tell people in that sense is try and do something similar. So to that movement, but without being on your feet. So instead of maybe squatting, that might be something where I have you lay on your table or your bed and slide your foot in and out. And then once that gets a little bit looser, then try to squat again. And that's just something that allows the joint and the muscles around that joint to really get a feel for a similar movement without the intensity of gravity pushing down on us. But it's one of those things too, be proactive about your health. Always address it first and foremost. Health is one of those things as we get older, it tends to get a little bit more frightening, but it doesn't need to be. It's one of those things that we are so advanced in our medical fields and our health fields that any question you may have on your health, if you don't know who to ask, or if the senior center doesn't have the resource, come over here. I will gladly give you any resource or show you where to go or anything like that. Because I think it's important to have the answers. If you have the answers, you're going to be more willing to address everything. Did that answer the question?
It did. So if someone, I mean, it sounds like anybody could benefit from your services. If someone was interested, would they contact their PCP? Could they call you directly and you work with insurance? How does that work?
So you can do either. So Wisconsin is a direct access state. So what that means is you do not have to talk to your primary care physician before coming to see a physical therapist at all. You can, and that's okay. But usually what they have found is you actually end up spending more money going that route right now. So what they did is direct access allows you to kind of cut out going to primary care. By you coming to see me, I would do an evaluation. And then what ends up happening is I send all that information to your primary care anyways, so they know exactly what I found and they stay in the loop that way. But then it just takes away that extra trip that you would have to see the primary care. So it's a little bit more easy that way, but either way works.
And are you doing all in-person appointments or virtual or?
Great question. We are actually doing a little bit, we're primarily in person right now. I would say about 90% in person for most patients, but we do have the option right now for telehealth or virtual appointments as well. With everything going on COVID related, it's related to insurances and stuff like that, but for the most part, everything right now is covered virtual or in person. So we do both. And then something else we do too is we do offer 10-minute free screens for any individuals who have aches, pains, or if they're like, hey, my strength isn't what I think it should be. Do you think physical therapy will help? That's something we do for free. And it's mostly a way for us to kind of see if we can tell if physical therapy will help you or not, without you guys having to pay any money or insurance having to pay any money.
That's wonderful.
I know in the past, I've done this 2 different times in my life. I had to change a situation where my knee is pretty much useless and I'm waiting to have surgery, but I have to lose some weight first, which is hard with everything that's happening. But I know prior to that, I was a very active person and exercised a lot. And now since this, I'm limited, but I still try to exercise every day. And I know that personally, 2 times I have gone into Capital Physical Therapy and taken in a copy of the exercise program that I'm currently doing. And we just gone over it exercise by exercise with the therapist, and she looked at what I'm doing and she suggested changes where she thought I could make changes. She said, well, you're doing this exercise and you're doing that exercise too. And if you split the difference of the angle of your arm, you're doing them both. So, hey, I can cut an exercise out. So she made suggestions and, we looked at some things that maybe I could add or maybe take away from what I'm doing. And I think it's very beneficial. And it isn't one of those deals like you had to schedule 12 appointments. I mean, this is a single appointment. I went in, they looked at it with me, sent me off with their good wishes and,
I always tell my patients, I was like, exercises are meant to be perfect, but they are the most imperfect thing we have. So everyone's body is shaped a little bit different. Everyone's muscle strength, range of motion can be a little bit different. So some exercise that worked for, let's just say, John may not work for Jane as well because of that. And having that ability to just come in and see those little tweaks, have those little adjustments to make it more individualized for you is that's the important thing with regards to seeking out those answers that I was talking about. Because some of those exercises, you're like, John's doing that really well over there, and it's not really helping me. And that's something where you may not know how to change it, but going to seek out those answers, there's usually a way to adjust it and make it more individualized for you. And that can be same said about any diet or any sort of other physical activity besides just those PT exercises, like walking, how to walk a little bit differently, or how to approach going up and down a stairs a little bit differently, stuff like that.
And I have a question too about the breathing and the lung capacity and stuff that changes as you get older. There are a lot of books out there now on how to breathe. So we've been doing it wrong all this time. And are there any of these exercises or anything that you can do? I know I do the belly breath, where
that's a good one.
That expands and flattens out as I inhale and exhale. But any of these other ones, are any of them beneficial, or just
any of the other ones?
You're exercising your lungs.
I think any aerobic exercise is going to work the lungs a little bit, because the more you're moving in and out with your chest as well as your diaphragm a little bit, the lungs will get what I call as training. With regards to anything with regards to lung expansion, what we want to kind of just work on is range of motion. And with regards to your breathing question, those exercises are really good if we can kind of, how are you doing them, if you don't mind me asking? Are you doing the belly breathing on your back, or?
I do it sitting up. It's uncomfortable for me to lay on my back a lot. So I do it sitting up, and I figure if I'm doing it sitting up, kind of in an erect posture, that's the way I am for most of the day.
Yeah. Oh yeah. I think it's something too where you could probably expand on it to do maybe standing too, and just changing that position. So when you're up walking around, you get more of that kind of what I call as muscle memory, to have that a little bit more instinctual versus just breathing with the lungs, because they do want you breathing. Usually it's in a 2-to-1 ratio, and you don't need to know that, for diaphragm to lungs. And that's where that type of exercise is a perfect start to get that more dominant when you're breathing and not moving around. And I always tell people to kind of challenge themselves with different things or different positions. So if you were doing it when you were sitting down, do it when you're standing up. Try it when you're walking. Maybe try it when you go to stand up. Those are ways you can kind of challenge yourself a little bit differently, because then that also goes into how do we regulate our breathing when we're moving, which is an entirely different thing, and it can be a different challenge. but it's something that I think all people are more than capable of doing. They just have to break it down, go from sitting, try standing, and then once you get those more static positions nice and comfortable, that's where you would go into the moving ones, like the walking, the transferring up from a chair, that kind of thing. But I think the important thing is actually breathing, and I'm glad you brought that up, is a huge thing that we're kind of learning more and more about in the medical fields, and how important it is to a little bit breathe more through the diaphragm or the belly and a little bit less through the lungs. We breathe more through our lungs here. It actually kind of promotes more of this type of posture. And we want to keep everything nice and relaxed in our shoulders.
Is it equally as beneficial to you to do range of motion as it is lifting weights? Like, I'm not comfortable with my 10-pound weights anymore.
Oh, yeah.
6 is even a stretch. So if I would use 3-pound weights and maybe do 30 repetitions instead of 10.
Spot on. For anything with regards to strengthening, I always say it's important to challenge yourself, but if you can do more repetitions at a smaller weight, you're still challenging yourself, and you're actually challenging 2 systems, because the more repetitions you do, the more you're challenging your aerobic system. So that's all. It's kind of more bang for your buck in general. Now, if your main goal was to, I don't know, you have to move furniture at the end of this month, and you have a 100-pound couch you have to move with your spouse, that's something where I would probably say we might have to think about trying to figure out a better way to get you comfortable with higher weights and shorter repetitions. But that's a different conversation. For your question, yeah, more repetitions with less weight is more than beneficial. I think that's something that'll actually challenge you a lot more. And in long-term health, if you can impact 2 of those kind of quadrants I was talking about with your healthy aging versus just the strengthening in one in itself, that's better in general.
Okay. Thank you.
More than welcome. Any other questions?
Oh, Stephanie, I have a question for you. How would we access this presentation online?
Yes, so after this, I have to figure out how to move it from here to YouTube, but Elisa will help me with that. So by the end of the week, it should be on the Senior Center's YouTube page. If you have that information, or the link is in the Chronicle as well. And a couple of thoughts on that. We do have a yoga class on the YouTube page, as well as a seated yoga class. Anything from gentle exercise to higher intensity exercise. We have a number of the pre-recorded classes on there. We also have an exercise room here at the Senior Center, and you can sign up for an individual appointment, so we're COVID safe. You can come ride a bike if you don't have something at home. We're starting an in-house yoga class and a number of other things that Tyler mentioned about food and you know, getting involved in challenging your brain. We have some of those classes in October. So if you don't have the Chronicle, you can get that on the Senior Center webpage, website, and then, or you could call us and we could certainly connect. But yeah, I think Tyler offered a lot of great ideas, and thank you, Tyler, for taking the time to be with us and yeah, sharing your wealth of knowledge.
Thanks for having me. I appreciate it, guys. You guys have
Any
a good
other
rest
question?
of your...
Yeah.
Any other questions? Sorry.
But no, I don't think. I think we're good.
Well, you
okay.
guys have a good rest of your Tuesday. Thanks again for coming. I appreciate it.
Thank you.
Thank you, Stephanie, for sponsoring this and having it on.
Yeah, it's great. All right. Have a good day.
Bye, everybody.